where news comes first. This is WECT News at 6.
Hello, everyone. Thanks for joining us. I'm Frances Weller.
I'm John Evans. More than 500,000 North Carolinians could soon have better access to health care.
The State House of Representatives is likely to pass a Medicaid expansion bill tomorrow, sending it to Governor Roy Cooper's desk. WECT's Zach Solon spoke with New Hanover County Social Services Director today about how this will impact people here. Zach, if the bill becomes law, New Hanover County alone will see thousands of people become eligible for Medicaid.
Yes, Fran. North Carolina is set to become the 40th state to pass legislation to expand Medicaid coverage. It's a move some lawmakers say is long overdue. Finding access to health care can be difficult for low-income families, but help could be on the way. The North Carolina House of Representatives voted Wednesday to expand Medicaid eligibility. New Hanover County Social Services Director Tanya Jackson explains how this bill will change the lives of those in need.
The Medicaid expansion is based solely on income, and there are not the other eligibility factors that go with some of the other Medicaid programs, such as if you receive Medicaid, you have to be income eligible and maybe pregnant, or income eligible and have another type of need. With Medicaid expansion, it will be solely based on income eligibility.
She says more than 17,000 people in New Hanover County could become eligible if the bill becomes law, meaning people won't have to ignore their health concerns to make ends meet.
As we understood and saw very easily that there was a gap in Medicaid medical coverage for our residents. As research shows that individuals or families who do have Medicaid medical coverage, that frees up other money in the household for them to do other things with.
Representative Deb Butler hopes the bill will have an additional impact.
It's causing rural hospitals in particular to struggle to stay open, which means people aren't getting the care they need outside urban metropolitan areas. And so that's, I hope, hopefully one of the consequences of this bill is that we'll be able to save our rural hospitals and provide care to people across all parts of this state,
so that no one is left behind when it comes to their health. The expansion would be paid for with federal and state money pending budget approval. The bill still has to get one more vote of approval in the House tomorrow before it heads to the governor's desk, where it's expected to become law. Zach Solon, WECT News.